A new class, Sonata, Ambien, Lunesta, do have selective interaction, and they actually help protect stage 3 and 4 sleep, so they're definitely my top choices, but there are many ways to treat this. But you don't want to be on a medication that interferes with stage 3 and 4 sleep, because that's what you really do need. Tricyclic antidepressants, they were the original medications used from fibromyalgia. Rob Bennett, Don Goldenberg from Boston. Do they work? Well, they do work for some people. If you look at 6 or 7 studies to date, in 3 of the studies they worked, in 3 or 4 of the studies they didn't work. And the problem is there were so few people investigated in each study that they often didn't achieve statistical significance. But does that mean they don't work? No, it doesn't, and it's not a bad place to start because they're inexpensive. You use them often in low doses. Another thing, these were the initial medications used for fibromyalgia, but they were used in tiny doses, 10 milligrams up to 25. And when patients got better, the world thought, well, it's depression. No one's depression responds to 10 or 25 milligrams of amitriptyline or nortriptyline. So they're not used as antidepressant doses, and yet in some people they bring significant relief. Selective serotonin reuptake inhibitors, Paxil, Prozac, they actually, we think, don't do much for fibromyalgia, except they do treat depression, and if you've got depression and you're on one of these, you should definitely stay on them. But then we look at Effexor, and we look at Cymbalta. And every study to date has demonstrated they are effective for treating fibromyalgia pain. They're not indicated for it, so the insurance company can say, these aren't indicated, but they are effective in treating fibromyalgia pain. And then the norepinephrine dopamine enhancers definitely can make you feel better, reduce your depression, but generally haven't been proven to work for fibromyalgia, and there's no reason to take MAO inhibitors unless you're really severely depressed. What about analgesics? We know NSAIDs, even COX-2 selective NSAIDs, by themselves don't work for fibromyalgia. This has been studied on numerous occasions. So if you find that the only thing you need to treat your fibromyalgia is an anti-inflammatory, then you have something else going on. So if you know that when you take Advil 4 times a day, you feel 100% better, you may have fibromyalgia, but you have something else that's responding to the anti-inflammatory if that's all you're on. Goldenberg from Boston did find that if you used low-dose antidepressants in combination with an anti-inflammatory, then the anti-inflammatory did help. But if you have found that anti-inflammatories alone work, then you really need to be evaluated further. Acetaminophen certainly can relieve pain, and then tramadol is unique. Tramadol is a weak narcotic, so it's not regulated, but it also has the kind of antidepressant that helps pain. In every study to date looking at tramadol, tramadol has helped fibromyalgia pain. It's not indicated for fibromyalgia pain, but in every study to date, it's helped it. What about narcotic analgesics, opioids? Well, actually, to date, not one study has demonstrated that a stronger opioid works compared to tramadol. Does that mean they don't work? No. Many of you are on opioids, and because you're on that group of medications, you're functioning. So it's one thing to say no study has demonstrated that. It's another thing to say, has the study been done appropriately? Are there enough studies? And another thing, again, to say it doesn't work, because there actually, I think there's excellent clinical evidence that it works. But we use them usually last, and I think most people would say we wait too late to use them. We wait until people become dysfunctional, unfortunately, before using this group of medications. But typically, you should have tried other things first, including things like physical therapy if it helps you, acupuncture if it helps you, and then start on a low dose. And then most people with chronic pain actually require slow release narcotic analgesics as well. Again, there's no proof they work, but I think you can make an argument clinically they've worked very, very well in giving many people back their lives. Muscle relaxants, tizanidine, very good at bedtime, helps you sleep. Probably the best muscle relaxant we have, cyclobenzaprine, one of the original medications given to fibromyalgia patients. Baclofen is a spasmolytic like tizanidine, much, much cheaper, generic, like tizanidine, but much cheaper, but also can be given during the day. Orphenadrine is Norflex. Norflex is during the day because it usually doesn't make people drowsy. Then Scalaxin. And then finally Robaxin. Many people are in Robaxin. Robaxin's been around for 30 years. If you actually look at the physician's desk reference, it will tell you Robaxin possibly works on muscle spasm. It's been 30 years. It might be time to move on and try a different muscle relaxant. Growth hormone. Dr. Rob Bennett, who until recently when he resigned was chief of rheumatology at the University of Oregon Health Science Center in Portland, he discovered that up to 1/3 of patients, and this has been published in the American Journal of Medicine among other places, had reduced levels of IGF-1, insulin-like growth factor 1, which is associated with growth hormone deficiency. When he treated them with growth hormone, almost all of their symptoms resolved. So he went to the company that makes growth hormone, which is sometimes up to 1,000 a week. And he said, I have this group of patients that are suffering who respond to growth hormone. And the CEO said to Rob Bennett, they're going to have to continue suffering. This is not to be confused with the ads you're seeing about oral growth hormone. This is injectable growth hormone. I have 2 patients on it. They're both independently wealthy. I wish they'd come up with a grant for everyone else. And they're doing great on growth hormone. But you first have to have a level checked, and it has to be low for you to benefit. So it's the IGF-1 level you're looking at. And Rob Bennett has actually published this on 2 or 3 occasions in peer-reviewed journals, outstanding articles. It's not indicated for it. It appears to work in many patients with fibromyalgia. And then anti-seizure medications, particularly Neurontin, Lyrica, they all have neuropathic indications. Only one of them has a fibromyalgia indication, as you know, and there's actually only one medication the FDA has approved for fibromyalgia. And the good thing about that is 5 years ago, the FDA looked at a medication for fibromyalgia. It rejected the application saying fibromyalgia is not real. A year ago, with all of these changes, it finally not only said it's real, but also said it's non-psychiatric and approved Lyrica. So politically, that's helped tremendously, that the FDA now says it's non-psychiatric, it's real, and a medication can help it. So we do know the mechanism of Lyrica. It's the same as Neurontin. It affects this thing called the calcium channel, but really what it does is it reduces excitatory neurotransmitters, which would go along with this central pain problem rather than a muscle problem. So it's really exciting. We've got a mechanism, and we've got a medication that works for it. So Lyrica is the only medication indicated to treat fibromyalgia. It doesn't mean it's the only medication that treats fibromyalgia. So those are 2 distinct things. And I think if you've got a good program that works, stay on that program. Dopamine agonists. Andy Holman, who just retired from clinical work, unfortunately, was a real advocate of using some of these medications, such as Mirapex. It appears to work in some patients in very high doses. There are 2 problems with very high doses of Mirapex. One is it inflames your stomach, so you'll need to take something for stomach problems. The other one is it causes compulsive gambling. So the company that makes Mirapex actually refused to give Andy Holman a grant to provide it, and now they're really excited they didn't, because they would have been sued for that. So it does cause compulsive. So